My name is Lisa Chinnock and I am the Health and Wellbeing Lead at Llwynypia Primary School in Rhondda Cynon Taf. We have worked closely with SHRN to develop a case study sharing our journey to healthy eating and well-being for learners and families. Llwynypia Primary School is a community-focused school with a strong commitment to promoting health, well-being, belonging and inclusion at the heart of everything we do. We currently have 179 children on roll, with 30.7 of our pupils eligible for free school meals. We are a founder member of the Taff Morgannwg Health Promoting Schools National Quality Award Professional Learning Community, working collaboratively with regional and local partners to strengthen our whole school approach to well-being. We have successfully renewed our third National Quality Award re-verification in May 2023, reflecting our sustained commitment to continuous improvement in health and well-being. The purpose of this presentation is to share how reliable, high-quality SHRN evidence helped us identify a genuine need within our own school community and take meaningful learner-centred action to improve healthy eating. SHRN data supports our school development plan, aligns with the curriculum for Wales, strengthens self-evaluation of whole school approach to emotional and mental well-being, provides robust evidence for inspections and enables us to monitor trends over time. Our school have engaged with the SHRN Primary Survey since the pilot in 2022 and again in the rollout in 2024. The invaluable support from Rachel, a Healthy Schools practitioner, helped us to interpret the data meaningfully. This was important because it allowed us to move beyond just numbers and actually think about what the data meant for our pupils in practice. One of the most valuable aspects of SHRN was the clear, independent insight it gave us into the pupils' eating habits at a school level. We found that only 35% of pupils ate fruit daily, compared to 48% across Wales, and just 29% ate vegetables daily, compared to 37% nationally. Years 3 and 4 were the lowest, at 28%, and importantly, every year group was below the Wales average. What this told us was that we weren't dealing with isolated concerns, but a whole school pattern. This really echoed what staff had already been noticing in the classroom. Things like lower energy levels, difficulties with concentration, and challenges around emotional regulation. The difference was that now we had clear evidence to back up those observations. This was a turning point for us. The SHRN data gave us the confidence to take action and ensure that our next steps were rooted in evidence rather than assumption. It became a key driver in shaping our Healthy Schools work and helped us to prioritise the areas that would have the greatest impact. As highlighted in our case study, the SHRN data has been invaluable in identifying key areas for improvement, and it has directly informed and strengthened our Healthy Schools Action Plan.
We are members of the Healthy School Council, and we're looking at the SHRN graphs together. Our teachers gave us time to understand what the results meant and to think about our own habits. We all agreed that healthy eating is something we need to improve. The SHRN graphs helped us see what really matters, so we could make plans based on real information, not just guesses. They also helped us have good discussions, and we quickly decided that healthy eating should be a top priority. We talked about some of the challenges we face, like not having enough time at breakfast, forgetting to bring fruit, not always knowing what snacks are healthy, and sometimes not having easy access to healthy food at home. We felt that our ideas were listened to, and we had a real voice in what should happen next. We worked together as the Healthy School Council to help plan changes that would really work for our school. We made sure the ideas were meaningful and realistic so everyone could join in and benefit. Mrs. Desmond organised a menu tasting session so pupils and parents could try healthy foods. Ms. Price set up a food pantry to support families. Mrs. Chinnock ensured all classes now have dedicated daily food snack time. We helped design a healthy lunchbox leaflet and have shared this during whole school assembly.
Our approach has been truly collaborative, with every part of our school community playing a role. Our learners have been central to this work, helping to identify priorities from SHRN data, leading healthy eating assemblies, shaping our food pantry, and even developing resources such as the Healthy Lunchbox leaflet. This ensures that changes reflect real learner experiences and needs. At the same time, staff have modelled healthy routines and consistently embedded conversations about food and well-being into everyday teaching. Families have also contributed valuable insight, particularly through engagement with Breakfast Club and the pantry, helping us better understand experiences beyond the classroom. Governors, alongside support from our health promoting schools practitioner, have used SHRN data to guide informed decisions and meaningful action. The result is a more connected, fairer and health promoting community focused school where everyone contributes to positive change. To understand our early outcomes, we've drawn on a wide range of evidence, including pupil voice, teacher observation, pantry feedback and whole school assemblies. Together, this gives us a balanced day-to-day picture of how our SHRN-informed work is developing. We are already seeing a positive impact. More learners are bringing fruit for snacks, showing a growing interest in healthy choices. Confidence is also increasing, with learners more willing to discuss healthy lifestyles and contribute in lessons and assemblies. Engagement in health and well-being has improved, with stronger links being made between food, energy, mood and learning. Beyond the classroom, use of the community pantry continues to rise, supporting families with affordable produce. Importantly, learners feel listened to and proud, knowing their voices have shaped a real change. This is a truly collective effort, learners, staff, families, governors and partners working together to build a more connected, fair and health-promoting school community. Moving forward, we are focusing on sustaining and strengthening this work. We will continue to prepare for future SHRN cycles so that we can track trends over time and refine our actions based on reliable data. Working closely with our health promoting schools practitioner remains a key priority, allowing us to share learning across our cluster and feeder schools and ensure consistency in approach. We are also looking to build on our practical health initiatives. This includes expanding access to fruit and vegetables, embedding positive hydration habits across the school day, and strengthening our work around dental health. At the same time, SHRN will continue to support us in evaluating our whole school approach to emotional and mental well-being, ensuring that pupil voice, staff observations and wider feedback remain central to our planning. Overall, this ongoing cycle of evidence, reflection and action will help us to continue to meet the needs of our learners effectively. Here is a link to our case study, a SHRN-led journey to eating and well-being for learners and families, which is now available on the SHRN website, giving a more detailed explanation of how we use SHRN in Llwynypia Primary School.